Thank you so much for joining us today. My name is Dr. Karen Drenkard, and I'm the Associate Dean at GW University School of Nursing. We've partnered with Gallup to interview chief nurses across the country to hear about their leadership experiences managing COVID-19. We're here today with Kelly Saucerman Howard, the Vice President of Patient Care Services and Chief Nursing Officer at Creighton University Medical Center, Bergen-Mercy in Omaha, Nebraska. Creighton is managing the COVID preparation, and we appreciate hearing the perspective from Nebraska. Kelly, thank you so much for taking time out of your busy schedule right now and giving us a few insights into how Creighton is managing. Can you start with briefly describing your role to me and what you're responsible for at Creighton?
Sure. I have the privilege of leading over 500 nurses, and I'm responsible for the quality, service, nursing care, and delivery in acute care areas such as med-surg, intermediate care, trauma and med-surg, ICU, our EICU, our heart and vascular oncology, and trauma and emergency services. And I have been with the organization for just about 1 year.
Thank you, Kelly. That's a wonderful, exciting first year to have in the midst of all of this. Kelly, can you share with us where you are in the planning process and some of the challenges that you're facing as you're managing day-to-day operations at Creighton?
Well, the safety of our staff, patients, and families are our top priority. And as part of a large health system that spans across the country, we've actually had the opportunity to learn from our colleagues who have been immersed in the COVID-19 pandemic since its emergence. Using these learnings and some of the current CDC recommendations and partnering with local health departments, we have implemented some standardized processes for screening, diagnosis, and the care and treatment of suspected and COVID-positive patients. As you know, emergency management and crisis response training has been an integral part of hospital operations. However, these are really unprecedented times for us. So as we look to the future, that's what we're basing our planning on.
Can you share with us what is happening in Nebraska? Where are you in the surge process right now?
Sure. Based on the predictive modeling projections, the surge is expected to hit Omaha around the first couple of weeks in May. We utilize the predictive modeling information to anticipate the COVID-19 resource requirements, and we partner that with our local health department data to train cases within the community so we can update our surge plan both locally at the hospital level and across the division. As part of our ongoing focus in preparing for the surge, we have been communicating changes in the surge plan as we've updated monitoring our curve and continue training procedural nurses and techs to assist in the patient care activities on our inpatient acute care units. We're providing additional staff training regarding COVID-19 and infection prevention measures, and we're reviewing our current PPE supply and confirming that our PPE and equipment staff are all readily available at the point of care when needed.
Thank you for sharing that, and managing the surge, resource capacity, and training is all part of managing the employee workforce, but how are you managing the well-being of your staff? People, the nurses and clinicians in particular, have a lot of worries and fears. What are you doing to help them manage that while they're still able to care for the patients that they know are coming?
Well, intentional leadership visibility 24/7 is really key to this. During this time, we've been delivering food and snacks to the department, and at the time, we can take that opportunity to encourage staff to access some of our stress-reducing initiatives like debriefings with our pastoral care department, our employee assistance program, and we are providing opportunities for them to participate in creative art projects with inspirational messaging designed to encourage both staff, patients, and families during this difficult time. We're also able to use these rounding times to reduce stress by communicating process changes and updates related to COVID-19 and discussing our organizational alignment and how we're allocating supplies and staff during these rapidly changing times.
That's really great. I love the integration of the arts into care for your clinicians. That's really a terrific strategy. Thanks for sharing that. So if there was one lesson that you could share, one lesson learned or one piece of advice that you would want to share with other nurse leaders across the country, what would that be? What would your one lesson learned look like?
Well, from a positive aspect, the resiliency and adaptability of our nurses and our healthcare team has really been inspirational. The pandemic has evolved so quickly, and it's really changed the way we've cared for patients and families. And I think during these times, we've used technology and creative ways to really continue to keep patients and families connected. And our staff have really taken the position of being surrogate family members for a lot of these patients. So I think as a large healthcare system, one of the real positive lessons is how quickly you can deploy and reallocate staff, supplies, and equipment to those areas in need, and how the team really adjusts to that and really just takes ownership of these are our patients, our community, and we're here to serve no matter what it takes. So as I round every day, I'm really honored and proud to lead such a dedicated team of nurses who are caring for our community.
Kelly, thank you so much for sharing. We're really thinking of you as you work through the next few weeks and appreciate everyone who joined us today. Thank you.
Thank you.